So SNOMED codes are the international language of health, basically. So there's different types of codes. There's billing codes, terminology codes, procedure codes, diagnosis codes that all health systems use. SNOMED codes are terminology. Importantly, they're not billing codes. You can't use them for billing. There's 2 million of them. You would not give doctors 2 million things to bill. That would just make all our problems worse. So what they are is they give meaning. What was meant by any word that can be put into a digital health system. What did the doctor mean? So when they put DD, they often do, that's something that's in a health record. Did they mean diverticular disease? Did they mean developmental delay? Did they mean, you know, there's about 4 other meanings of DD. So it gives you meaning based on context, and it's the international language of health used around, like most countries in the world now. And because they give you meaning, the codes can be used for a lot of different things. They're very helpful in research, for example. They're very important in research. They're not research codes. Some people think they are. They're not. They're terminology codes. But you can use them for a whole lot of things. So if a patient presents with fever, cough, sore throat, you'd get 3 SNOMED codes that would say fever, cough, sore throat. It's not about adding a dollar value to that. It's just giving information to the government. And then you might bill item 23, which is a GP consultation. But then it makes sense. You would spend 20 minutes with someone who had fever, cough, sore throat. But you also protect patient privacy with coding, because you don't have to, you don't need patient details and you don't need a lot of words. So it's quite a good way of passing information around while protecting patient privacy. So that's a sort of a crash course in SNOMED, but it's the international language of health. And in fact, every other country, this is again from my PhD, so the American Medical Association has been for like 10 years working closely with SNOMED International to align and harmonise their clinical terminology products. So the MBS equivalent in America is aligned with SNOMED. And WONCA, the International Organisation of Primary Health Physicians, have also aligned their code sets with SNOMED. So, you know, and Australia, SNOMED's part of Australia's digital health strategy. It underpins Australia's digital health strategy and is already sitting in the back of My Health Record. So it's already part of the framework. We just need to, I believe it's one of the ways we can get better visibility over Medicare claiming as well. Someone might come up with a better solution, but that's the one I've come up with in my thesis. But it's, yeah, it's an interesting area. Thanks, Marianne.
No worries.